because it's a wide and thin part, we want to put the cassette crosswise again. And how many pictures or views do we do for the clavicle? Two. So we would again do it at 40 inches, but I'm going to leave it here so you can see better. Okay? Everybody okay with that? Okay. Okay, so the clavicle, I'm going to start with like the 10 by 12 size that I have. Obviously it's a small bone, so I'm going to collimate down quite a bit. So on the first one, all I'm going to do is basically center right on the mid shaft here of the clavicle. So halfway between the acromion and the head of the clavicle here, the SC joint. So you can tell where the acromion is, you can put your finger right there and palpate it. So your light needs to be just beyond that. And almost anybody, you can, even on a heavy person, you can usually feel it. You might not see the lump after a while because they have a lot of extra love there, but if you push a little bit, you can feel that bump, right? Because that's pretty prominent. And then, you know, smaller the person is, the more prominent it usually is. If someone's had a fractured clavicle, sometimes you can visibly see like a little lump on their clavicle because it's such a thin bone, so close to the skin surface. Okay, so I want to just center halfway mid-shaft. I know it's a little harder to see with this collimation light because it's open centering, but so I'm right mid-shaft, and then again I'm going to put my marker here, or I could put it here. Some people don't like the markers in a weird position. Have you encountered that? They like want it a certain way. Yeah, what, like up and straight up and down? Okay, so I guess we put it this way there. I just don't like to put it there to keep the light open. So I would put it maybe off from the end of the clavicle here so we don't get it in the joint space, the AC joint. Okay, so I'm going to collimate, whoops, fairly close. Yeah, I guess that would be a good idea. You see what she did? Mm-hmm. Yeah, she went from AP to PA, so she fixed her shielding. Now, I guess even, can you unclip that a little bit? For females, it probably wouldn't hurt if we brought it up around the breast, but you do want to be careful and not bring it up too high, because I'm always, especially with the shoulder, we don't want to get it on the, and then now we're getting a little short down on this area, but we don't want to get it into the scapula, so. Okay, so with the clavicle, there's no arm position. It doesn't really matter. And again, if they've got a fracture, their arm is weighing that fracture down, so they're likely going to be pulling onto their arm anyway. Okay? So pretty straight shot, make sure everything's centered, and that's it. Now the axial, on her side, what was the range that we could angle for the axial? There was a range depending on the patient's body habits.
Something
15 to 30. So remember, the larger the patient, usually their chest is more round, so their clavicle's somewhat already axial to some degree, so you don't have to angle as much, so that would be a 15 degree. Someone who's smaller, their clavicles are going to be 10 down here, a little bit lower in the chest, which means you have to angle more, because the purpose is to get the clavicle up away from the lung field, or the ribs, so we can see it better. So it's like doing a lateral in a different perspective. So I'm going to come down. Now 30 degrees, you could probably bring your tube in a little bit. We don't really seem to adjust it when we're in the upright position so much. Okay, so what we're going to do now, because I've got a 30-degree angle, and I would say, even though the range is 15 to 20, when you do your procedures list next week to turn in, do a little survey when you ask the techs or see what they say about clavicles. I'm going to guess that most of them say, oh, we just do 20, or we just do 15. I bet you a lot of them don't know there's a range from 15 to 30. They just always do 15 or always do 20. But sometimes they have to go and do another one with more of an angle because they haven't cleared the ribs. Okay, so this time, instead of hitting the shaft right on the bone, we're going to go right underneath it because we're virtually skinning through the bone this way, right? And then, of course, we move the tube, so what do we have to move? Move the tube, move the button. Okay, not too bad. So I started you off on a harder section. Now you're going to feel like, it's a piece of cake. Cakewalk. section's a little, because of the decubes, it's a little more challenging, but not, I think this is the easiest one. This is the one we usually start off with, but. Okay, so I'm gonna show you some things on the skeleton and then I'll show you on the table.